India's COVID-19 death toll has surged past 200,000. This is one of the highest death tolls in the world. The numbers are rising fast, driven partly by a new, more infectious variant. Countries around the world have begun sending medical aid to India, including desperately needed oxygen, as the wave of new infections overwhelms its healthcare system. Hospitals are being forced to turn patients away as authorities scramble to get equipment to those who need it most.
In some Indian hospitals, the oxygen supply has run out. People who might have survived the disease are dying as a result. There's no oxygen in all of town. My mother was admitted 3 days ago. I was told she was fine and recovering. All the tests were done. Then last night they said they didn't have any more oxygen. She passed away. Hospitals and ICU units across the country are overwhelmed. After weeks of a sharp rise in cases, the healthcare system is collapsing. Oxygen has become the most precious of commodities.
I'm buying oxygen at the rate of gold. The situation come to that level.
They are lowering the oxygen level, but it needs to be higher. So this is the problem. With oxygen and hospital beds running out, the government is scrambling to get equipment to the areas that are hardest hit.
We have compressed oxygen that's moving across the country using the country's railway system to get it to the places that need it the most.
Emergency supplies from the UK have begun arriving, and more help is promised from abroad. After the final details have been clarified with the Indian side, the first shipment should be on its way in the next few days. But in the meantime, many Indians are left to fend for themselves, doing all they can to care for loved ones. Some drive for hours in search of oxygen. I have come from very far to collect oxygen for my father. I'm scared that although the oxygen is available today, what will we do if it's not available tomorrow? But until help arrives on a larger scale, many people in India are left gasping for air.
For more now, I'm joined by Tarek Yasarevich. He's a spokesperson for the World Health Organization in Geneva, Switzerland. Thanks for being with us this morning. First of all, we've seen pictures of hospitals in India being overwhelmed for days now. Can you tell us whether or not the pandemic in India is peaking, or could there still be worse to come there?
Well, good morning. It's very difficult to predict how the situation will evolve. What is important really is that we all support health system in India, that people try to protect themselves so they are as much safe as possible, and that they follow the advice that is being given by health authorities. As in any country, when you have a sort of a combination of factors, such as new variants that are likely to be more transmissible, mass gatherings, when the vaccination levels are low and people are relaxing their personal protective behavior, we can see this sort of explosion, although we have not seen in any other country on this scale. We need really to stand with India now and try to help as much as we can.
What role are the new virus variants that we're hearing about in India playing in the pandemic there?
Well, viruses are changing, and this is normal. We at WHO, we are following and monitoring these changes that occur as the virus transmits from population to population. We have identified already 3 variants that have been first seen in Brazil, in South Africa and UK, that are more likely to be transmissible in a faster way than the original one. So there is a new one that has been identified in India. Preliminary studies are ongoing. We need to understand more, but it seems that this variant as well has the capacity and potential to attach to human cells more easily. That would obviously meaning more people being infected, and that would lead to more hospitalizations and more deaths. What we need to now is really try to contain as much as possible this transmission through making sure that people who are sick follow the advice, do not necessarily go to hospital, but take care at home when possible, try to isolate. Here, government is trying to provide the right information through hotline. There is also consideration of having community screening center, providing information to know where beds are available in which areas.
Of course. What about the oxygen situation in India? Does the country have enough medical oxygen, or are oxygen supplies just not getting through to the areas that need it quickly enough?
Well, there are reports of shortages of oxygen from different parts of India. The government is stepping up, trying to increase the production of oxygen in different parts of the country. They're also using their air force to try to dispatch supplies where needed. As you have already said in your program, there is also international mobilization. WHO is providing 4,000 oxygen concentrators. US has already committed to provide 10,000, and first of those have already arrived. Other countries like Singapore, Russia, Saudi Arabia have also started, as well as European Union, started to mobilize support for India. It is important to say that in the absence of drugs for COVID-19, we have only one that has been recommended so far. That's corticosteroids and dexamethasone. The oxygen is a life-saving commodity, and we hope that these shortages will be overcome soon.
Mr. Jasarevich, thank you very much for talking with us. That was Tarek Jasarevich from the World Health Organization in Geneva. Our Delhi Bureau Chief, Amrita Chima, is following this story closely, of course, and joins us now. Good to see you, Amrita. The healthcare system across India, it seems to be overwhelmed. Are people even trying to reach hospitals anymore to get treatment?
Absolutely, Terry. Those people who are critically ill are being rushed to hospitals by their relatives, and sometimes with very disappointing results, because they find the doors of the hospitals shut because they have no more capacity to take people. The number of cases, particularly in a city like Delhi, have been so high that the whole medical infrastructure is being put under huge strain. We got a glimpse of that in your report. People are not running short of oxygen. Now they're running short of beds. Medical staff are in short supply because half of the wards are COVID tested, are tested positive for COVID. Critical equipment is not there. So people are sometimes just left hanging, waiting outside hospitals, languishing on footpaths, waiting for medical attention. And we've seen some harrowing stories about people just losing their lives, waiting for someone to come and give them help. Now, this is taking a huge toll on people here, including doctors. Now, I've seen doctors in middle of interviews break down and cry. And one doctor said, people are coming here and look to me for help, and I have to just watch them die. I am so helpless.
Amrita, you mentioned a lack of critical equipment. That applies also to oxygen supplies. There have been reports of oxygen and essential medications being sold on the black market at hugely inflated prices. Is this problem being tackled by authorities?
Certainly, when the need is so great, Terry, of course, a black market has sprung up, especially for oxygen, but also for drugs, for ventilators. And authorities have cracked down and taken some hoarders into custody. But as I said, people are desperate. And when they are so desperate, they find a way around to get this critical equipment that they want for their loved ones and are prepared to pay any price, as we heard in this report. I mean, oxygen is the price of gold. So yes, but we have some international aid coming in that's given a big psychological boost to India as a nation. They see that the world is watching, the world wants to help, but that aid has not yet trickled down on the ground to people who need it most.
The true number of deaths from COVID-19 in India is rumored to be much higher than officially recorded. Why do you think that is, Amrita?
You know, it's difficult to say, Terry. I mean, national and local media is talking about the death toll being about 5 to 10 times more than the official death toll. And the official death toll is pretty high as it is. Part of the reason is that, in fact, many of the people who have died, they've not been officially COVID positive tested. That's because laboratories are under huge pressure and they're not able to test everyone who is sick. So these people are then not part of the official COVID death toll. Yet we're seeing images coming from crematorium, we're seeing images coming from burial grounds, and the numbers of bodies that are coming in is quite unprecedented. In fact, one of the other indications is that they're running out of ambulances to take bodies to cremation grounds and burial grounds. And there was this heartbreaking image of a man in a private car with a body strapped on his roof, heading down the street, ostensibly to a burial ground or a cremation ground, simply because he couldn't find an ambulance to take his loved one there.
Horrific scenes. Amrita, thank you very much. That was our Delhi Bureau Chief, Amrita Chima. Let's catch up on some of the other developments in the pandemic worldwide. Brazil's Senate has opened an inquiry into whether President Jair Bolsonaro's government committed criminal negligence or corruption in its handling of the pandemic. South Korea hopes to encourage more people to get vaccinated by exempting those who've been inoculated from quarantine measures. Currently, anyone who's been in contact with a confirmed patient or returned from overseas travel must undergo 14 days of quarantine. And the Netherlands is lifting several coronavirus restrictions that have been in place since January, including a nighttime curfew.